All right. Hi, everybody. Right on time. Right on time. All right. I'm seriously going to be chugging down my decaf this evening and pretending it's the real stuff, but I'll get what I can take. Mm. To anybody watching the replay, if you don't mind hitting replay in the comments section, and if you have any questions, go ahead and tag me, and I'll be sure to get to those questions because I know some of you are in different time zones, so you're not able to watch it completely live. But I always like to get those questions in. Hey, Stephen, how are you? Guys, I see some people popping on board. So I am excited about tonight. There's a lot of fun announcements, and I get to reveal some of the stuff that I've been working on. So I'm excited to share that with you guys for this show today. All right, guys, as you come on board, I see some people. Roll Tide, Stephen, roll Tide. It's funny. That's actually going to be my dad's Father's Day present this year. I'm going to finally get him a Roll Tide sweatshirt. Hey, Urbano Torres, that's a new name. This is your first time coming on the show. We got Mark. Yes, it is bat time. Is that bat time? Well, you are on the right bat channel, Mark. Oh man, guys, as you jump on board, let me know who you are, where you're from, and what's in your coffee mug. That's your initiation for joining the Cosi Talk Show. I love to interact with my audience. I love to know who it is I'm talking to. We got Robin, you're here. Oh, happy Wednesday, mate. Yes, you did make it early for a change. I'm like, oh my gosh, you're here early. I love it. Hey, Carlos, welcome on board. We got Tom McIntyre joining us as well. Wonderful. I'm seeing familiar faces and some new names. Love to see them both. Love to see them both, guys. All right. I'm going to hang around for another minute and we're going to get started. I'm going to let you guys jump on board this evening. Doug, oh, one of my dogs is on board. Oh, thank you, Doug. I am so excited. I've been working so hard on some of these projects, so it's nice to be able to kind of announce one of the big ones that I've been working on. Hey, Barbara, how you doing, Barbara? We got Bonnie on board. We got Susan Walker. Carlos with the protein drink. Compadre, what's going on, man? Yes, it is super hot up here as well, Mark. As you can tell by my hair, it's hot and humid. So, hey, Kenny, I'm sorry, I can't speak this evening. What's up going on? Kenny from Chesapeake, Virginia. We've got Lonnie. He's one of our newcomers to the show. And Lonnie, I'm so excited to have you on board. And Lonnie, I'm going to brag about you again tonight. So last night I did a webinar with Vitalfit, the skincare company that I work with because I absolutely love their products and what it does for my patients, the skincare products. And Vitalfit sponsors a free webinar twice a month that I and Greg Menino, this amazing prosthetist, we both host. So, guys, if you're interested in just getting even more education, more interaction with different members of the community, check out on the Vitalfit web page under their events and their calendar. You'll see where you can sign up. They do it through Zoom. So another great area. So I was bragging about Lonnie last night because he sent me some videos of him walking. And the last video he sent me, he stood up from his chair and look ma no hands, started taking some steps. So guys, I absolutely love it when you send me videos. I love it when you send me updates about your progress, about your two steps backwards even. And usually at the end of my messages, I tell you, please keep me updated. And I really am sincere about that. I do love learning about how you're doing with your lives and how things are going for you. So can't hear anything. Oh dear. Susan can't hear anything. Can everybody else hear me? We got Daniel on board. We got Brett. There. Okay, you can hear me now. Wonderful. We got Anthony. Oh, Anthony, I'm so glad you came back this week as well. Carlos is another Tar Heel. There we go, another fellow Tar Heel. We got William Mays. Connie, thank you for joining. We've got Chuck listening in from the YouTube channel. Guys, I always like to remind folks, I am broadcasting also from my YouTube channel under the same name, Cosi Talks. It's pretty easy to find. I've got a lot of really great videos that I've been posting on YouTube, guys. Gave it a makeover, so it's easy to find some of this information. And also, for those of you who help me spread the word about the show, I know there's a lot of folks out there that don't particularly care to use Facebook or they find it hard to find the live shows. So sometimes it's easier to find stuff on YouTube. So another option for everybody here. We got Harsh on board. Oh, Susan, have I ever had anyone allergic to Vitalfit because I am? No, actually, Susan, I've been using their products for almost 2 years. And when I mean I've been using their products, I mean me personally, I've been using their products and I've been handing them out to my patients. I have yet to see an allergic reaction to Vitalfit. It's one of the reasons I love their products because they really don't have any of those harsh chemicals in there that will typically cause allergic reaction. It was designed by a dermatologist for sensitive skin, for diabetic skin specifically. So Susan, if you're having any problems with that, please send me a message. The Vitalfit team does like to receive feedback and they do like to know what's going on. So if you're having any problems, please, please, please send me an email or you can send me a message on Facebook and I'll be sure to pass it along. So we got Harsh from Richmond, Virginia. We got Keith. Hey, man, what's going on, Keith? Cheers. We got Line Comadre on board drinking water. Girl, get yourself some Sambuca or something like that. Get something more interesting than the water. We got Johnny V. I like how you just posted the house emoji because Johnny V is in the Cosi Talks house. Love it. All right, Benny, you can hear me good. We got Sandra from Gainesville. Okay, Susan, once again, if you don't mind just sending me a message about that and I'll be sure that they know about it. We got David on board. All right, man. All right, guys. So we're going to go ahead and get started. For those of you joining in for the first time, welcome. My name is Cosi. I'm a physical therapist, amputee specialist. I've been a PT now for over 18 years. I have a practice here in Florida, in Tampa, Florida, called Palanca, which is exclusively for working with the amputee and limb loss community. Oh, I know. I saw that, Robin. I've got all of Richmond here tonight, Robin. I love it. I love it. Love, love, love it. And we got Daniel here from Southern Indiana. We got a nice spread tonight. So guys, I've been kind of teasing a little bit about some of the big projects that I've been working on. And I was able to release recently in the past couple of days, one of the smaller projects. Smaller. So there's still an even bigger one to come. Bigger one. Huge. But the one I can tell you about is my live event. And I am so excited about this. We've been working so hard, my team and I. So last year when we had all the shutdowns with COVID and conferences got canceled and the amputee boot camp clinics got canceled and walking clinics and running clinics, everything getting canceled, right? I said, well, my show is virtual. So, let's kind of bring these conferences back to you all in the comfort of your own home. So last year in July, I did a 3-day live event where I broadcasted from here and we did educational topics, special guest interviews, exercise demonstrations. And guys, we got over 15,000 views on those 3 days alone. And they're still posted, by the way, guys, those videos are still posted on my YouTube website under live events. So if you guys are wondering, like, what is she talking about? You can go to my YouTube channel and check it out. We had so many giveaways. My house was just full of all the free swag that we were giving away for that event. So this year, guys, it's been rough on everybody, small companies, big companies alike. I had 2 beautiful companies who were able to come in and help provide for this conference. And without their help, I would not be able to do the live event again this year. So special thank you ahead of time to College Park Industries and Prosthetic Center of Excellence. And we're going to be talking a little bit more about them later. But guys, put this in your calendars, June 1st through the 3rd, right? That's a Tuesday, Wednesday, and a Thursday, 1 p.m. Eastern time every day from the Facebook channel and YouTube channel. I'm going to be broadcasting, okay? And I'm going to be posting a lot about who's going to be on my show. I've got people flying in, guys. People are flying in to be in the studio for this live event. And I am so excited about the guests that are going to be coming on. I'm excited about the topics because these are topics that everybody is always asking me questions. I'm excited about being able to provide exercises for these topics because it's tough for me to do exercises with this kind of setup right now, but I'm going to be able to do it for the live event. So guys, mark it on your calendars. If you have not already done so, and I know I'm putting out all my plugs right now, go to my website and sign up for my email subscription because there is where you're going to get all the updates on the educational topics, who my special guests are going to be, and how you can get in on the free giveaways. Quick poll. How many of you guys came to my live event last year? I know there's a couple of people here that was their first time watching me was during that live event. How many of you came to the live event last year? Quick raise of hands. All right, we got Louis Angel here saying hello from California Bay Area. Oh, nice. We got Jean, Joni Dan's mom. Well, Joan, thank you for joining us this evening. Brett says he casted me to the TV. Nice. Hey, Kevin, how you doing? Kevin, I have got your question here. Got your question here, Kevin, for this evening. We got Kay coming in she's back home in Chile, Alaska. Whew. Trent from Colorado. So Barbara says that she was at the live event. William Mays was at the live event. Mark was at the live event. Kay saw the reruns. Reminders are set. Okay, guys. So those of you who were at the live event last year, you guys knew how much education we brought for those 3 days, jam packed. And again, the giveaways are amazing. So there you go. I have the event posted on my Facebook page. So if you feel so inclined, sharing it out to your support groups and helping spread the word, I would really appreciate it. So let's go ahead and get started on questions because that's what the show is about. A bit more of a quiet week this week when it came to the questions. So guys, go ahead and feel free to post in your questions now. Let's see, the first one comes from Randy. Hey, Johnny B, you were there too. I know, man. Randy asks, what is the cost of osseointegration operation in the US and how long does it take to walk on it? I assume there is PT. Yeah. So osseointegration is something you guys have probably hearing a lot more about because it's here in the United States soil. Okay, so osseointegration is a procedure, and in some, depending on the type of osseointegration that's done, it can either be a one-step surgery or 2 surgeries that are done over the course of a year. And what they do is they take a metal rod and they implant it into the bone. So whether it's the femur, your thigh bone, or your tibia. And obviously with upper extremities, they're also doing this as well. They implant it in there, and then there's a little piece that sticks out of the skin. They create what's called a stoma, an opening in the skin. So the little metal abutment sticks out, and then you can connect your prosthesis directly on there without having to use a socket. Okay. So this is actually a surgery that's been around for many, many years, but we haven't heard much about it because it was only available internationally. So recently, the FDA allowed, with certain special exemptions, for certain surgeons to start performing the surgery here in the United States. And we actually did a really big month on that with a company called Integrum. And they're the makers of the Oprah system. That is one particular method of osseointegration. So we did a big, huge show on that. We need to update that show, actually. Now that I think about it, we need to update that show, guys. We haven't done a show on osseointegration in a really long time. We need to update it. So as far as the cost of osseointegration, I actually don't have that information. I do know from a couple of international patients that I've worked with that it was very expensive, obviously, because they not only had to pay for the surgery in full, but they also had to pay for travel expenses to go out of the United States and staying for the period of time during their recovery at whatever country they had it at. Here in the United States, I don't have that information yet. I just got this question today, but I'm going to try to find out this information for you. I'm not sure if insurances are covering it, if they're covering part, all of it, or none of it. But I can tell you that yes, physical therapy is most definitely involved in this process. It is a very intense recovery and rehabilitative process. And in my opinion, if you don't have the rehab team working with you, you will not have a successful outcome. Okay. So I've been having a lot of folks ask me, saying that they're thinking about osseointegration, that they're hearing about it. And so here are my thoughts. My thoughts on osseointegration are this. It's meant for a very specific individual. Okay. And it needs to be done by a very specific surgeon, meaning a surgeon who's not only received the specialized training to do this procedure, but it needs to be done by a surgeon who has surrounded himself or herself by a team of PTs, a team of OTs, a team of social worker, nurses, to make sure that the outcome is done well. Okay. So there are very strict protocols in terms of how the person starts to put weight again into the osseointegration surgery. And again, depending on which technique is used will determine how fast the person does the weight bearing. But it does need to be done very carefully and very meticulously. And the reason why I'm kind of hitting on this is because recently I had a phone call from a gentleman who knew that I knew about what it is that I do and called to ask me, and his words were, well, I got a surgeon here in my area who says he's thinking about it and thinks he might go take a course on it. And that just made my heart sink a little bit. Okay. Guys, this is not one of those weekend courses that a surgeon can take to go learn to do this surgery. This is a surgery that requires a lot of training, a lot of experience, and a lot of hours in the OR. Okay, so if this is something that you're thinking about doing or you're curious about, make sure you go to the right resources. Okay, make sure you go to the resources that have that team in place, to a surgeon who's done this surgery multiple times already. Got it? All right. Hey, Andrea, there's my OT. So Daniel asks, can you run with Osteo-Integration? So here's what I have heard, right? And this is something I need to probably update my information on. The quick answer is no. The OI, as of right now, would say that no, you are not supposed to be running on the OI. That is one of the limitations in terms of the impact on the prosthesis. Okay, I have heard whispers internationally of some folks who have become very, very, very active and have attempted to run with OI. But right now, I don't have updated information. So right now, if you had OI, I would tell you that no, it is not possible to run on it at this moment. Let's see, Kay says, I'm having tremendous lower back pain. I know I have a lot of arthritis in the lower thoracic area. Any hints on some exercises? I do yoga, been swimming every day in Hawaii, but it just aches and I can't seem to get a handle on it. Kay, whenever I hear of someone who's having pain due to arthritis, especially in the spine, I'm always for the conservative methods first. And that is, okay, what can we do from a strengthening standpoint and from an alignment standpoint to see if we can help alleviate the pain? Okay, I know you're a very active individual. So my first indication for you would be work on that core, right? And not just the upfront abdominal muscles. I would also say your back extensors, okay? Especially if you're having that pain in the thoracic region, where people will tend to have the kyphosis, where they curve forward, and sometimes that will exacerbate the arthritic pain. So anything that can possibly help you with strengthening those back extensors, right, and keeping you up. I love yoga. I think it's a wonderful exercise for folks, especially when they have arthritis. Tai Chi is another one that I also love with folks who have arthritis, because it's very low impact. Swimming is another fantastic one. But at some point, guys, arthritis is a progressive disease, right? And sometimes it just does get to the point where you need to either seek some sort of medication to help alleviate the pain and help bring down some of that swelling and inflammation, or just talk to a surgeon and see what they have to say in terms of what's going on there in the spine. So, okay, but again, that's a progression. That's a progression. All right. Hey, Mary, glad you could join us this evening. Lonnie asks, is there some kind of quick release in case you fall on it? If you're referring to the Osteo-Integration, I don't believe so, Lonnie. I don't believe so. Hey, Kays, how are you? Yeah. And again, guys, with arthritis, I've seen, obviously it's part of what I work with as a physical therapist, especially folks who have arthritis in their hips and in their knees and in their joints, and, things just wear down. So obviously the first line of defense for anybody who's experiencing arthritis, whether it's an osteoarthritis or a degenerative joint disease, is, how can we help with the pain management, help bring some of that swelling down that's around that joint? And how can we help strengthen the structures around those joints to help support the structures and hopefully prevent more wear and tear and stress and strain? But guys, sometimes with some folks, it gets to the point where the joint is just so completely worn out, okay, that they have to either go in and clean out the joint or replace the joint in the case of the hip or the knee. With the arthritis located in the spine, obviously they try to do much more conservative methods. Every once in a while, they may have to go in there and do a little bit of a clean out in the spine area. Let's see. Tom says, I have to talk to my doctor about OI, and she also said no running with OI. And I just want to add an addendum to that, guys, because it just kind of came to me right now. Again, it's been a long time since we've done a show on OI, and I know I need to refresh my update and update my knowledge on what's happened since the last time I did that show almost 2 years ago. But Tom, I do remember that the gentleman who came on my show from Integrum, he said that you cannot run on the OI itself, right? But you can, in certain cases, make a running socket and wear a traditional socket to run with the OI. So what they would do is they would make a traditional socket that would mold around the little abutment that's sticking out. So that's, and in that case, they would be, you know, it wouldn't be weight bearing directly into the OI side. It would be a traditionally fit socket. Let's see. Okay, so Daniel says, what's it mean if an individual is left side or right side rotated and how it affects gait? Okay, so Daniel, there's a couple of different ways that a person can be rotated and how it can affect their gait. Probably the most common one is when you see the foot rotated. So when I'm, you know, kind of assessing my patients for the first time and I take a look at their alignment and I have them stand up, you know, I work myself, okay, starting at the head, looking at the level of the shoulders, looking at the level of the hips, knees, and get to the feet. And sometimes what I might see is the anatomical foot, the biological foot is facing forward and the prosthetic foot is rotated out. Okay. Sometimes that happens because things become loose. Sometimes it happens because the prosthetist will externally rotate the foot a little bit to give a little more stability to somebody who's new to using the prosthesis. In some cases, a person naturally has that alignment. So in the case of somebody whose natural foot is externally rotated, then the prosthetist might set the prosthetic foot to also be externally rotated to kind of give them a matching pair. Okay. In some cases, it's also because the socket was donned improperly. It was put on improperly. So the person may have put it on improperly and it's rotated. So they have to take everything off and put it back on again. In terms of how it can affect the gait, if that's how the person normally walks, it might help stabilize their gait by having the foot rotated out just a little bit. For me, if when I have my beginner patients and they start off with the foot externally rotated, as they improve with their gait, I might ask the prosthetist to set that foot back to facing forward if that's what their other foot also looks like. Okay. Oh, Carrie, sorry, I was having a time what you meant by CK socket. I'm assuming you mean, okay, so Carrie says, I got a check socket last week and I feel so out of shape. When I wore my first socket, I walked so good. If I had pants on, you wouldn't know I had a left below the knee amputation. So Carrie, if you have a new socket and you're trying out a new check socket, it probably means that your old one was probably too big, right? So you were probably doing little compensations with the old one. And now that you're in a prosthesis that ideally fits you a bit more snug, fits you a little bit better, your body can walk a little bit better. So yeah, you might be feeling tired because you're probably walking better and walking more now that your prosthesis fits you better. Okay. Susan Walker, that's a great question. Susan asked, do you know what age typically it's just too hard to use a prosthesis or there is no age limit? Age ain't nothing but a number, baby. I had my oldest patient came in to learn how to walk with an above the knee prosthesis and he was 94 years old. 94 years old, okay? And he was able to be walking, he was able to walk safely around his home with a walker. And he was able to walk, you know, from his home to his car, get to his appointments with his caregiver, and lead a fairly functional life at 94 years old. And he started learning how to use it at 94, not that he had been using it for years prior. So Susan, it's about the activity level of the person. And the one person that comes to mind, I don't know if he's on tonight, is my buddy Tom. Okay, Tom is a bilateral above the knee amputee. And Tom, I believe, is in his 70s. And he walks 3 miles a day as a bilateral above the knee. Okay, and he's been an amputee for many decades, so he's had a whole lot of practice, Susan. What I see is it's just like in my population of folks who have 2 legs, you know, the people who are in their 80s and 90s that are still doing 5Ks, you know, it's because they kept themselves active and they kept on some sort of fitness routine and they watched their diets and they minded their P's and Q's with regards to their health. I see mind-blowing things that folks I see on Facebook of amputees, bilateral amputees, unilateral amputees, all sorts of different levels of things that they accomplish and they do. So no, age for me, not a limit, not a limit. It might change how you do things as you get older. And you may have to work harder. I'm starting to finally learn that myself, that I do have to work harder at maintaining my strength, at maintaining my fitness compared to when I was, 20 years old. But that to me is more of the difference. It's the effort that you put into maintaining your fitness, maintaining a healthy lifestyle. That's what's going to determine how successful you are with continuing to use your prosthesis later on. And I know we've got a couple of people here. One young lady in particular from Richmond who leads a very, very active lifestyle. Um, Harsh says, I don't think we should worry about that as we can't age. It's our leg. I like that, Harsh. Um, okay, I see what you mean, Susan. Like it's difficult to put it on due to age. Like when you're 90, hands may not work well enough. Okay, so Susan, that's a valid point. What I find is that usually by the time that folks reach that age, they're so used to it. So the same way that you're used to bending down and tying your shoelaces, as you get older, that's going to be a little bit harder to do. But as you age slowly, you figure out ways to compensate and make it work. And usually, if someone who's been an amputee for a while and they're reaching those upper decades, usually there's something else going on that's prohibiting them from being able to put on their prosthesis on their own. And it's not necessarily related to being an amputee, it's just perhaps they have something else going on, like a dementia or another movement disorder that's going on. She says, my hubby wants to know because he figures he has to push me around. Susan, I think you need to put some bets on it now. I think if you stay fit and active, you're going to be the one pushing him around. There, said it. All right. And Kay, that's an excellent point. She says, but they may have much better technology at that point. Let's hope, maybe regeneration. Oh my gosh, Kay, that would be amazing. But guys, and that's a very valid point, guys. Just think about where the technology, and yesterday's, for example, going back to the webinar I did yesterday with Vitalfit, we were talking about all the different kinds of liners that are available now to help with sweat, to help keeping the temperature slightly cooler inside that, inside that liner. And yeah, at one point I stopped and I was like, guys, these options, some of these options weren't even available 5-10 years ago. And now we are talking about 2 or 3 different options for temperature cooling type liners. Okay. And just even, hello, the dawn of the microprocessor knee. When I started my career 18 years ago, none of my patients had those. We still had door hinges and wooden feet. So Susan, I think I'm gonna go with Kay on this one. That by the time you reach 90 years old, the technology is going to be much more advanced there. All right. It's all a state of mind. Yeah. No, you're not, Susan. You're not. You're going to think positive. Mary says, can you find an amputee karate group? Is there one? I'm sure there is, Mary. I know I've seen videos online of people doing jujitsu, of doing wrestling. So I'm pretty sure I'm going to go out there on a limb and say that there's an amputee out there who's doing karate. As far as where to find one, I don't know. My first thought would be go to Google and just type in amputee karate and see what comes up. We're certainly seeing a lot more adaptive sports exploding everywhere in our country, to the point now where I think if in your own zip code you just type in adaptive sports or amputee sports in your zip code, you're going to start to find organizations nearby that provide services. Let's see. Stephen, you crack me up. He says, I keep hoping someone's going to splice the lobster regeneration gene onto my leg. All right, here. Let's take on another one of these questions, guys. Kevin asks, along with Vitalfit products, I also have some Alps antiperspirant spray. Would you suggest using these together? Okay, so guys, when it comes to skincare, I'm kind of like a stickler with my patients because I've seen just so many people coming in with things that they tried that were over the counter that just didn't work. And, so for me, I have definitely been a huge fan of the Vitalfit. It's worked for basically 100% of the people that I give it to in my clinic. and many of you out there who use those products. Now, if you haven't used the product, I just happen to have a sample right here. They have the cleanser, the day moisturizer, liquid to powder, and the nighttime moisturizer. And it is kind of meant to be used as a system. So when people order this, I usually recommend just use this on your leg and just see how your leg reacts for 2 weeks. It is meant to help combat the bacteria, the sweat, the odor that you might find when using a prosthesis. Okay, so usually I tell people just use these 4 products, right, for 2 weeks and see how your skin reacts. And then after 2 weeks, I say, okay, let's see, is the skin too oily, which means do we need to take away one of the moisturizers, or is the skin too dry? So maybe you can add a little bit more of the moisturizer. Are you still experiencing a lot of sweat? So Kevin, with me, I used to recommend antiperspirant all the time. I used to recommend that all the time to my patients. I used to have to tell them, yep, the night before, take your shower, put your antiperspirant on, and make sure it soaks in the whole night so that when you go put on your leg the next day, it doesn't just slip off, and I've moved away from that a lot in the past couple of years. Number one, it's very inconvenient. A lot of people, especially here in Florida, like to take their showers in the morning. So then you put the antiperspirant on and it's still slick and it makes things slide up and down in the liner and in the prosthesis. So it really doesn't help much with that, right? And in some cases, people will have sensitivities to these antiperspirants. Okay. But that being said, I'm also the person who says, let's see what works for you. And again, in Florida, it's extra hot, extra sweaty, extra humid. So Kevin, for example, I have one of my runners that she uses the products and she uses that liquid to powder lotion, which is great for helping reduce the sweat. But whenever she goes on a run, obviously the amount of sweat is quite large. So she'll do a little bit of antiperspirant just for the part when she goes running. Okay. So that's usually what I tell folks is just add one product at a time, see how your skin reacts to it. And in the case that you might have an allergic reaction, you'll be able to identify what product is causing it if you're just adding one product at a time. Okay. And as far as antiperspirant is concerned, I say use it sparingly. There's a lot of stuff in antiperspirant that prevents you from sweating, and some folks don't like to put that stuff into their body. But if you feel like this is really becoming a problem, just using a little bit and at the times when you need it. Okay. So Susan says, I was thinking about having a 3D image socket made, but my old-fashioned prosthetist got all offended when I asked about it. I'm chuckling, Susan, because I always call myself the old-fashioned PT. So, Susan, actually, you're going to definitely want to sign on for the next Vitalfit webinar. It's going to be later on this month, May 25th. I remembered. And we're going to be talking about sockets. And one of the sockets we're talking about is the 3D image socket. Greg is going to be talking more about that. So yeah, I have been hearing much more about it. I know there's one clinic in town that does it here, and I'm hearing very good results. I am a little old-fashioned, Susan. I like the old-fashioned casting, and especially when you have a prosthetist who's really good at what they do. But Susan, it's about you. You're the one who has to live with this prosthesis every day. You're the one, like I say, you're the one who wakes up with this foot and leg every day. So if you feel that the socket your prosthetist is making for you is simply not comfortable and not allowing you to live your functional life and get through your daily activities, then you need to start having some of these conversations and finding out, okay, if it's the socket, is a different technique warranted, or are there adjustments that can be made to the socket to make it more comfortable? Carrie says, I feel like I need to have physical therapist that I had years ago. Do people go back to PT when getting a new socket? Sometimes yes, Carrie. Sometimes yes. So whenever I have a patient come through my clinic and they complete the traditional physical therapy routine, they learn how to use their prosthesis, I give them a pat on the back, send them back off to their lives. I always tell them, once you're my patient, you're always my patient, like it or not. Okay, and I'll check back with my patients every once in a while. Some patients I check back every couple of months. Some patients maybe once a year. I'll just call and just see, hey, how you doing? How are things going? And the reason for that is, yeah, people change their parts, whether they're changing the prosthetic foot, they're getting a new knee, or they're getting a new socket. And sometimes that can throw things off depending on how drastic the change was, Carrie. So I always recommend have that PT in your Rolodex, have that number and have somebody that you've already established a relationship with, so that if you have any problems with a new componentry or just something that changes, your body ages and now you're developing a pain in your hip, you have someone already in place who knows you that you can go to. So oftentimes, Carrie, if my patients are like, I don't know, I'm kind of got this new foot and I'm kind of walking funny, but I don't know if it's just me. I was like, you know what? Come into my clinic. Let me just eyeball you for 10 minutes free of charge. Let me just see what's going on. And then I'll let you know if you're good or if we need to start PT again. And it's just that simple, just that simple. But Carrie, that actually leads to the next question. The next question that was posted was, have any of you relocated after amputation? What kind of doctors would you recommend establishing right away? Okay, so this is something that I feel is important for people to know. A lot of it is, well, my body has changed drastically. What does that mean for the rest of my life? Who needs to be someone who's keeping tabs on me versus the doctor or the clinician that only sees me every once in a while? So here's kind of just my basic package. Everybody over the age of 2, okay, should have their primary doctor. Obviously, for people under the age of 18, that is the form of a pediatrician. Over 18, it's a primary doctor, either internal medicine, usually it's a family practice, family medicine doctor, okay? He's kind of the head of your team. He's the one, or she is the one, who does your checkups every year, runs routine lab work every year, make sure everything is in ship shape, right? Ideally, you see this person once a year, even if you're healthy, just so they can have baseline on how you're doing as you age, okay? Next thing, your specialist, okay? If you lost your leg due to diabetes, that would be your endocrinologist. If you lost your leg due to vascular problems, peripheral vascular disease, peripheral arterial disease, okay, then you need to have a good vascular surgeon or cardiothoracic maybe, okay? If you're somebody who had a traumatic injury and you lost your limb due to trauma, and you had several other injuries, that's probably going to be your orthopedic or your trauma surgeon. Okay. For whatever reason you lost your leg, you need to have that corresponding doctor. Okay. If you lost your leg due to diabetes, you still have diabetes, which means you still need to keep up with your endocrinologist now more than ever. Okay. Because you need to protect that other leg. Same goes for the person who lost their leg due to vascular disease, or the person who lost their leg due to complications from an autoimmune disease. Okay, you've got to keep up with these specialists and not let time go by. Even if things are going well and everybody's healthy, a once a year check-in, guys. Once a year check-in, okay? And again, whatever team you have in place, you need to make sure that they are talking to each other. And that's something that I really advocate for. The left hand needs to be talking to the right hand. And I'm thinking right now of a certain patient I have who's on dialysis. So he's being followed by a renal, a kidney doctor. But he also has his primary doctor. And right now, his blood pressure is not doing great. It's out of control. It's out of control. And I had to send him back to the doctor to get it under control. And the problem is his kidney doctor is not talking to his primary doctor. Okay. So one is saying take medications, another one's saying add medications, and it's a little bit of a hot mess right now. Okay. It's a little frustrating for this patient, and understandably so. But as a patient, you have the ability to get your doctors to talk to one another and say, hey, this doctor says this one says this. Y'all need to talk to each other. Okay. So something else to keep in mind. So, okay, we got the primary doctor, we've got the specialist. Next on the top of that list is PTOT. PTOT. And guys, this is not just because folks are amputees. I say this for anybody who is a human and is aging, because as we age, things break down. Okay. And this is where the services of a physical therapist or an occupational therapist can be so important. Okay. And certainly as an amputee, all the things that we've been discussing here, whether it's arthritis in your back due to the alignment of your prosthesis, whether it's because you have a new socket and things are being thrown off. Okay. Having that PT or that OT that you establish a relationship with, who can keep tabs on you, even if it's just once a year phone call. Okay. Good to have, because then when you do really need the PT, you've already got them on hand. Next thing, mental health. Mental health, mental health. I am not a mental health professional, but I am an advocate for mental health. Anybody who's been through a physical trauma, guys, whether it's cancer like myself, whether it's amputation, okay, we need mental health support. And that can come in many different forms. It can be with a certified peer visitor through the Amputee Coalition. It can be your local support group. It could be a psychologist for those of you who may have a history of depression or anxiety or another mental health disorder, okay? Mental health needs to be on that list, especially if you're moving somewhere new and you're trying to establish yourself. Having just even knowing where the local support group and when they meet, even if you never go, but you know where they are when they meet for and then whatever you might need them. Okay, so that's my list of clinicians that you need to have: the primary doctor, the specialist, PTOT, mental health. Am I missing anything for my clinicians out there? Connie says, I am at 85 and a 14-year below the knee amputee. I have no problem. Thank you, Connie. I want to be like Connie when I grow up. She's a really cool lady. Let's see, Kay says, a shout out on how great the Vitalfit system is game changer for me. I don't use the day moisturizer, but the other three are terrific. Yep. Yep. Okay, hang on, reading through these comments. All right. Guys, if you do need to contact me, all you can do, you can either contact me directly through the Facebook, my messenger there. Also, you can contact me through my website. I do check messages and I do return messages. So if I did miss any of your questions tonight, guys, go ahead and send it there so I can make sure I get this information on the questions. Let's see, Denise, sorry, okay. Denise says, I am looking for some additional gait training to get out of some habits I've developed. Original physical therapist didn't specialize in amputees. I was a walker before amputation and would like to get back to walking 2 to 3 miles a day. I can do it on a treadmill, but not outside. I think it's related to my gait. Is additional training a good idea? Denise, the reason why I have a really big smile on my face is next week's show, it's going to be tailored for you, Denise. So next week I'm actually having the Vitalfit back on the show. Greg's going to be on the show with me, and we're going to talk about how to stay active after you've finished the traditional training with your prosthesis, specifically for summer. And for me, I have a walking program that I pretty much give out to all of my patients. And a lot of that walking program comes back from my days of working in the heart transplant units, where we had to keep those folks moving until they got their heart transplant. So learning how to build a program from someone who is very, very ill and has very poor endurance, and how to put that and how to progress that kind of a walking program. So Denise, you can get back to walking. You can get back to walking. So Denise, I don't want to get too much into it now, but please come back next week and I will be giving you my little, it's a very simple formula, but how you can get yourself back to walking. Hey, Mona, nice to see you. All right, we got Carlos. Carlos says, I keep in touch with my PT after 12 years and she is retired. I love it, Carlos, and I'll bet you your PT loves hearing from you guys. I love hearing from my old patients. I love hearing from viewers. You know, as PTs, I joke around. We didn't go into PT school or into the profession to become millionaires. We did it because we love working with people, as with many people in the healthcare profession. So keeping us updated on your progress, we love hearing that. Carrie, you haven't been to your physical therapist in almost 15 years. You're either doing rock star things or I don't know what. And guys, I joke around about it, but you know, sometimes the time to look for a physical therapist is when you don't need one, right? When you need one, you know, if you're in tremendous amounts of pain or you've had a bad injury, you know, you're just frantic trying to find anybody who will treat you, right? So sometimes when you don't need the PT, that's a good time to start scouting around and do your homework and really find one and interview one and just see for when you do need it. But I might be a little biased. Let's see. Wow, Daniel says I drive 100 miles to see my physical therapist. Stephen says, ironically, not one on the list of doctors will know how to treat amputees. Yes and no. I respectfully disagree with that, Stephen. It all depends on the doctor. You know, the same way that you have some physical therapists who have a lot of experience working with amputees and some physical therapists who've never worked with an amputee. It's the same thing with doctors. And you just have to do your homework. Typically, the doctors who will have seen and worked with amputees are your family medicine doctors, your physical medicine and rehabilitation doctors. That can also play the role of the primary doctor. Okay. And certainly when it comes to surgeons, there are certain surgeons that that work and do more amputations compared to other surgeons. So it's sometimes a needle in a haystack, Stephen, but it is possible to find. And again, I'm going to tie this back to the mental health support. Okay, if you're somebody who belongs to a support group, if you're somebody who's had a certified peer visitor visit from someone from the Amputee Coalition, okay, these are people who have resources who can connect you to the right clinicians as well. Okay, so that's my 2 cents on that one. All right. Brett says, my physical therapist and prosthetist talked today. I was thrilled. I'm thrilled for you, Brett. That's awesome. That's a winning combination right there. Winning combination. Yes, I am a strong advocate for mental health, Joan. And again, you know, just a quick history on that. I am a recent breast cancer survivor. I just recently celebrated 5 years. I am officially in remission. And when I was diagnosed, it to say it came out of the blue would be the biggest understatement of the year. It was completely unexpected. And I was considered to be a very young breast cancer patient. And you know, the year that I went through surgeries and chemotherapy and more surgeries, and then getting put on more medication afterwards, you know, getting through it on a physical level was challenging. But getting through it emotionally and spiritually and mentally, that was the bigger challenge. That was the bigger challenge. And I realized I needed to have that mental health support. I have an amazing family, a wonderful husband, parents, and my kids who were in my community that came and surrounded me. But I needed to have other people that I could talk to. And in my case, I have my small circle of breast cancer survivor friends, and they became my support group, you know, so needed to be able to talk to other women who had been through what I had been through. And that was part of the healing process. So yes, I am a strong advocate for mental health. So Mark says I'm mental. Mark, man, there's no solution for you, Mark. No solution. Susan, and Susan, it's never too late. You know, and you'll hear me say this, it's never too late to start physical therapy and improving your fitness and your gait. And it's never too late to start improving and getting your mental health back on track. It's never too late. And we've had some wonderful resources here, Susan. The first one I can recommend to you is, again, Amputee Coalition. We had them on the show a few weeks back. Their certified peer visitor program. I've had so many people speak glowingly of being able to have someone who can talk to them, who knows how to talk to them and how to connect them and how to help. So Susan, if that's something that you're thinking about, I would visit their website, Amputee Coalition. If you Google it, it'll pop up right away, and look at their certified peer visit. Yes, thank you, Andrea. PM&R, physical medicine and rehabilitation. I did not mean to leave those fellas out. Trauma surgeon may not want to follow in the long run. This is absolutely true. A lot of times, some of these surgeons, the trauma surgeon, sometimes even the orthopedic surgeon, may decide that once the person has healed from the surgery, wounds are healed, they might discharge the patient. And yes, physical medicine and rehabilitation would be the ideal doctor to follow an amputee for the rest of their life. Thank you, Stephen. I try. Okay. All right, guys, let me see. There was one more question here. Please hold. Ah, yes, this one. Okay. So this gentleman says, I will be having my amputation near the end of May. Any suggestions on the future to get in and out of the shower? I have a 4 to 5 inch ledge below the doorway. I already know suction cups are not reliable. I don't want to know how you found that out. Okay, so guys, I actually pulled up a picture of my favorite device. Like if I had to pick one adaptive piece of device for bathroom, it would be, drum roll. Can anybody guess what my favorite device is to use in bathrooms for when people are recovering from surgery, not just amputation, but a lot of surgeries? My spinal cord injury patients, this is one of my favorite tools in the bathroom. Can anybody guess? I'll bet you my OT can guess. All right. Oh, good, Denise. I'm glad you'll be there. Let's see. Brett, can you send me a message about that? Can you send me an email to remind me to look into that for you, please? All right. So let's see if anybody guessed. I'm trying. Shower bench. Thank you, Joan. Yes. So I'm going to post a link. And guys, I'm not like endorsing this particular brand name of transfer tub bench. It was basically just the first one I picked out of Google when I put in. But I have sometimes a hard time describing what a transfer tub bench looks like. I love these things. I love them. You can throw them into a bathtub to get in. You can put them across the shower as, you know, to cover that ledge. That's the kind of shower I have. And I remember I had one of my friends who's an above the knee amputee come and stay with me, and being worried about that little 4 to 5 inch ledge to go into the shower. So guys, when folks are fresh out of their amputations, and then also with spinal cord injury, when I worked with quadriplegics and paraplegics, we used, not quads, but with the paras, we used the transfer tub bench. It's a wonderful, safe way to get into the shower, into your bathtub. And if there's one thing that people love when they come back home after surgery, after being in a hospital, it's just the ability to take a nice shower or a nice bath. So this is a really great way to allow people to do this safely. And then usually what would happen is, and you know, I worked in all the different levels of physical therapy, from acute care to inpatient rehab to home health and outpatient. So when I was working as a home health therapist, I would help folks learn how to manage inside of their bathrooms and figure out, okay, are we going to continue to use the transfer tub bench indefinitely? Or is there a way that we can help improve balance and skills and use crutches or a walker to be able to maneuver in and out of the shower stall safely? Okay, but the transfer tub bench is a wonderful intermediary tool to use. Yeah, people say they still use the shower bench. I'm seeing bath chair. Yep, Mary. Tom, you need to come running with me. Honestly, Tom, I love working in my clinic, but my favorite is when I have a running patient and I just get to go for runs with some of my patients who are runners. So Tom, you're just going to have to come run with me someday. We're just going to have to do that. So Lonnie says that's the exact style that I use, and it makes it so easy and safe. Daniel says my PT taught me how to run on my first foot. I love hearing that, guys. Love hearing that. Susan says I still use the shower bench. Yep, a lot of people using the bench. Yes, yes, yes. And guys, Joan says I'm a home health nurse. That's why she knows. That's why she knows. And guys, it's one of those pieces of equipment that, you know, I think it's anywhere between 80 to 100 bucks, which I know, you know, for some folks it can be a lot of money, and sometimes the insurance won't cover it. Sometimes, but for me, it provides such a nice, safe independence in the bathroom. So I encourage patients, okay, save some money in some of these other adaptations, but that's definitely one to invest in. Okay. Daniel says, I stand on one leg in the shower. Oh, that's a good idea, Tom. Tom says, after I shower, I always use a hair dryer to dry my leg off. Works great, so I can put my leg right on right away. There you go. All right, so guys, I have one. I'm holding you to it, Tom. Either like we're gonna have to meet at an Amputee Coalition conference or something and do a run. That's what we need. Oh, that'd be fun, guys. That would be fun. Okay, I'm getting ahead of myself. All right, guys, let's go ahead and I'm gonna do a Cosi poll. I like to do these Cosi polls because I like hearing from you guys. Ooh, Andrea, thank you for posting that. Amazon has benches for about 60 bucks. And she's right. It's never covered by Medicare. They don't care if you ever shower again. Guys, I don't know about you, but every time I would come home from the hospital after one of my surgeries, the first thing I thought about was like, I just want a hot shower just to feel better. Okay, so guys, Cosi poll, and this came up on last night's webinar with Vitalfit. What is in your daily travel pack? So, we all have our either, fanny packs, which apparently are back in style. We have my husband calls it the man bag, whatever handbag or whatever thing that we carry that stores the amputee supplies that you need. Okay. And I know a lot of times with my patients, I have to educate them and let them know, hey, from now on, you always have to have this, 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 and this on your person. You have to get either a bag or a kit or a Ziploc bag or something. So what is it that you guys carry in your care bag as an amputee? I want to hear from you. Hey, Kay, glad to have you on board. Joan says, my son's PT gave him his first shower and washed his hair. He's great, Pat Jules. And yep. Debbie says, hot shower and ice cream. Ooh, that sounds good. Go bag. Extra socks. Yes, Debbie got it correct. The first thing you need to put into that bag is extra socks. So this is the look my patients get when they come into my clinic and I ask them to go get socks and they say, oh, I didn't bring any socks. That's the look they get from me. They never forget after that. So Brett says his Vitalfit and charger. Ooh, you know what? I didn't think of the charger, Brett. Rubbing alcohol. That's another one that an Allen wrench. Thank you, Kay. Yes, an Allen wrench. It's great. And Greg said yesterday in that webinar, he's like, little screws come loose. It's always good to give it a good tighten up, and off you go. Baby wipes. Thank you, Leanne. Extra socks in my purse. Debbie says towels. So guys, you guys have pretty much hit all the ones that I recommend to my patients. Extra socks for sure. The little spray bottles, right? So for me, I don't normally advocate for using alcohol, but this is the one time I give an exception is filling a spray bottle, travel size bottle with half alcohol, half water. And it's for those hot, sticky days where you're in the middle of your day, maybe in your office, maybe transferring from one place to the other in your car, and you just have to take the socket off, give it a good cleaning with the alcohol, wipe it down with a terry cloth, clean the inside of your liner, put some dry socks, and keep moving forward with your day. Provided, of course, you're going to wash it better at night, right? Next thing, Allen wrench, and then Ziploc bag. And the reason why this is the mom of four, I have 4 kids, guys, and we're swim team and wetsuits and everything. So I always have Ziploc bags with me so I can put wetsuits. So in the case for you all, your dirty socks, have them in a Ziploc bag so that you know where to find them and they don't get lost. All right. Yep. So some folks who may not need the socks. Yeah. Stephen says, surprisingly, with my C leg and an alternative socket and not have needed anything. There you go. Glenda says, socks, shrinker, Band-Aid, Vitalfit travel size, and Allen wrench. Allen wrench, yeah. Allen wrench is a good one. Susan Walker says, elevated vacuum system, so I don't need socks. There you go. Benny says, socks. So just something that came up in last night's talk, and I thought it was kind of an interesting question. All right, guys. I have been talking a mile a minute tonight. Now I'm going to go sleep. But before I sleep, special spare battery for the Empower. Yeah, definitely if you have microprocessor, anything that requires battery charging, having that charger with you is definitely a huge must. Jess says bandage supplies, baby wipes, OTC pain meds, towel, and a lathe. There you go. All right, guys. So again, live event June 1st through the 3rd, 1 p.m. Eastern time. Go sign up for my website. It's just easier that way, guys. When you go sign up for my email subscription, I promise you, I am not going to inundate your email with a ton of spam, but just go sign up. You'll get everything you need to know, including how to participate in the free giveaways. And keep your eyes open. We're going to have some more details coming out in the next few weeks. Next week, Vitalfit is in the house. I talk a lot about them tonight. We're going to talk a lot about them next week, how to stay active. And my co-host Greg Menino is coming on board, so you can ask him questions too. All right, guys, we will see you all same bat time, same bat channel next week. God bless.